Hi, I'm Dr. Hazen, and we're going to talk about the postpartum period and some of the things to expect and think about. For everyone, when you have a return to your regular menstrual cycle is different. This can be dependent on whether you're breastfeeding. If you are exclusively breastfeeding, theoretically you could have some contraception and delay of return to your cycles for at least 6 months. However, this is not a perfect science, and especially if you're not breastfeeding all the time or intermittently, or if you really don't want to become pregnant again, then you want to think about the fact that you could have return to fertility as soon as 6 to 8 weeks postpartum. Planning for contraception should be something that's done individually with your healthcare provider, whether that's a midwife, family doctor, or your OB. There are lots of different options, some of which are oral, patch, long-term reversible contraception in the form of IUDs or implants, and this should be something that works for you and takes into consideration any health concerns that you have or other risks that you may have postpartum. In terms of thinking about conceiving again, we do know that for anyone, optimal pregnancy spacing is at least 12 months, ideally 18 months. If you've had a C-section, we do know that in Canada, we recommend at least 18 months between deliveries in order to be a candidate to have a trial of a vaginal birth. So if you're thinking about wanting to try for a vaginal birth after having a C-section, make sure that you space your pregnancies so that you have 18 months between them. If you get pregnant before that, it's no problem, just you would need to have a repeat elective C-section. In terms of other things, you come to your postpartum visit, maybe 6 weeks, there's a lot of sort of societal and public narrative that you come to this appointment and then you're cleared for return to sex. Now, certainly the minimum delay that you would want to have to resume sexual activity is 4 to 6 weeks, just to allow your body to start to heal. Of course, we don't completely heal for years after a pregnancy, but that is sort of the minimum amount to make sure the cervix is closed, risk of infection or other complications is less. And then obviously there's considerations depending on how you've delivered. So, if you had a more complex natural tear, or if you required an episiotomy at birth, that scarring may take a little bit longer to heal. The most important thing when we're thinking about having sex again after delivering a baby is that you feel emotionally and physically ready. And so even if everything is well healed, but you don't feel emotionally ready, then it's not time, So I think it's important to think about that, talk about it with your doctor. When we think about returning to sex for the first time, one way that you can kind of assess how things will feel is self-touch, just touching where any tearing was and seeing if there's any sort of scar tissue that maybe pinches. That can be quite common. Certainly, once everything is well healed, you can take either clean hands with olive oil, coconut oil, and you can actually just kind of gently massage the area, and that can actually start to help break down that scar tissue and increase blood supply to the area. Orgasms are another great way to increase blood supply to the area. So just thinking about how to get your body ready, and certainly just taking care, whether it's alone or with your partner, to explore and make sure that things feel okay the first time that you're having sex again. And then the other thing to think about is that a postpartum appointment, you don't have to have an exam, but you're always welcome to ask for one. So we're happy to have a look, make sure we also think that everything looks like it's well healed. And finally, a plug for pelvic floor physio. So it's something, if you haven't done it in pregnancy, usually the physiotherapist will want you to wait at least 6 weeks postpartum and until everything's well healed, because they don't want to cause any issues. But certainly, especially if you're worried about discomfort, worries about sex, or also worries about your bowel and bladder function, these are things that can be well assessed by the pelvic floor physio, and they can help direct you to what sort of other care or exercises that you may be interested in pursuing.